This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
Welcome back to our podcast.
Not sponsored. Wish we were.
I know.
It's like in our wish list or not bucket list, but you know what we mean. Anyway.
Changing up the flavor today.
Oh yeah, 'cause this is the one I typically have. Yeah.
Have you tried the cherry cola?
No, I need to. It's good.
She's good.
Again, not sponsored, but hold on. So today we are going to be talking about
The ever so trending.
very dense,
Yes.
very complicated.
Yeah.
My brain wanted to just melt.
I know. But we're going to keep it light.
Yeah. No.
The reason why we just wanted to, again, our point of our podcast is to bring actual information that is real. So we're going to be talking about mitochondrial disorders today.
Oh, introduce yourself.
Oh, sorry. I'm Evie,
I'm Julie.
and this is our episode on mitochondrial disorders.
Yeah. It's complicated. And my brain almost wanted to light up on fire.
It's complicated
but it was because I was trying to break it down for you guys, and we will break it down for you guys. But what I want you guys to understand is that this topic was a lot more complicated than I ever even thought of, yet it's being talked about. If it's something so
Simple. Yeah. Yes. So Julie was actually like, save all the energy for this.
yes.
If you've been living under a rock, I'm just kidding. If you are on socials, you will absolutely see the ever so trending mitochondrial challenges. This is not a real thing. Mitochondrial disorders are rare but real genetic disorders. Well, they're usually hereditary. But online and on socials, and to be honest, in the world of pseudoscience, everyone keeps on talking about mitochondrial challenges, which is not a real thing. And they try to interchange both of them, but they're completely different. So I understand this is actually something that's super complicated, but people that don't even have a degree in science are talking about it if they are experts in it.
Guys, I have read, I have done research, I have written scientific papers, okay? And when I say that this topic is dense and it's complicated and it has like tentacles, okay? Because that's the best way because everything that I would look into, then it would go to another site, and then it would go to another thing. And then and the worst part about it, and this is probably why like pseudoscience loves it so much, is that it is vague.
It is very vague.
It's vague in the
we've
symptoms.
talked about this in our episode on pseudoscience, so go check that out.
Yeah.
They love to be vague because the more vague that you are, it's just very broad and not specific. So it's less of a risk for them to be discredited because it's very vague.
Exactly. Just preparing for you for that. Trust me, I am breaking this down Barney style for you, and you're gonna see. It's very interesting, without a doubt. This episode's very interesting, and it's broken down for you to understand it. And then I hope that at the end of it, once we reach this end, you'll see. Yeah, I don't know how they got there with this. Like, I don't know how they must have stretched real hard and long to make the leaps that they've made.
It only takes one person
yeah.
to start using this kind of verbiage, mitochondrial challenges or mitochondrial, like, I don't even know what they say. They say the weirdest things and with zero context too. And then they're like, this is a good supplement for mitochondria. It's just.
And you can't, and let me just say, you can't just look at a person and say they have mitochondrial diseases. You can't do that. So yeah, let's start.
All right. So I'm going to start off with an example so that everyone can understand what I'm trying to say. Mitochondria is, if you take a regular biology class.
Repeat after us, children.
Yeah.
The powerhouse of the cell.
The powerhouse of the cell. It is like
Drilled.
it's drilled into us, right? Day one of cells. Okay. It's
Biology,
all the
whatever.
different types of, all the different types of units in a cell and what their function is. The mitochondria is the powerhouse. It basically supplies the ATP that we need. And ATP, just think of it as fuel for a cell to be able to have all its functions. So imagine the power plant in your city is starting to fail one by one. And then you start getting lights flickering, internet goes out. This is a bit like what happens in mitochondrial diseases, except the city in your body and the failing power plants are tiny parts of your cells called the mitochondria. We said it's the powerhouse of the cell. So often dubbed the powerhouse of the cell, mitochondria generate the energy in our organs in order for them to be able to work. So when they don't function properly, the mitochondria, everything in our body can really struggle. Maybe you might be asking, well, how is it that one mitochondria can affect your entire body? Well, if you really think about it, the single functional unit of a body is a cell. So if your functional unit is not correctly functioning, cells make organs, organs make the rest of your processes in your body. So yes, it can end up having different effects. Mitochondrial diseases are a group of rare but genetic disorders that can affect people at any age. They are individually rare, but collectively more common than maybe some people might think. But roughly 1 in 5,000 people, it's estimated to have a genetic mitochondrial disorder, a disease. Roughly 1 in 5,000 is estimated to have a mitochondrial disease, and about maybe 1 in 4,300 in the US, but the number actually might be even higher. To put it into perspective, it's been noted that every 30 minutes a child is born which may develop a mitochondrial disorder by the age of 10. But again, I know that sounds like a lot, but in the grand scheme of things, it's actually pretty rare, and it takes a lot to diagnose, which we're going to dive into.
Exactly. I mean, it's 1 in every 4,300.
Yeah.
And stuff like that. So remember, we have a really large population. So.
And genetics is very complex. Not each person with a mitochondrial disorder is going to have the same pathology or, the symptoms and things like that. So anyways, so these diseases aren't just medical curiosities. They have actual impacts on the individual and the families, and they hold really important lessons for science and medicine. And in this episode, we're going to shine a little bit of light on how it happens, how it's discovered, managed, and why it still matters, which is crazy to me. Not in a million years. If you were to put me back in medical school learning about mitochondrial disorders, I would never think that there would become a day where mitochondrial disorders were the center of social media.
Tell me about it. Tell me about it.
It's...
I really think that it was somebody that's not very science oriented, went down a rabbit hole, started reading all of these things, and then just grabbed onto it.
A family member got diagnosed with a mitochondrial disorder.
Yeah, and then they started reading up on it, and then they're like, oh my God. And then they misinterpreted everything because this is heavily based on genetics.
Yeah.
And God.
Yeah.
God, like geneticists are out there.
complex.
Geneticists out there, you guys are incredible.
Yeah.
I respect you so much because it is so complicated. It's so niche and complicated, and it had so many little bits to it. So they probably it's easy to misinterpret so many things when you start reading about this.
Yeah, I know. Trust me.
Yeah.
I remember as a resident, every single time I would have a patient and it was like history of a mitochondrial disorder, I was like, because it just made them, it made taking care of them a little more complex, a lot of thinking, a lot of teams together, working together.
Yeah.
So it was like, oh man. But sometimes I feel like everything happens for a reason. And maybe the reason why this is trending and everything is so that we can bring out more information. And maybe this creates more support for those patients that have true mitochondrial disorders and not challenges. Okay. So whether you're a millennial who vaguely remembers high school biology class, or, you know, you're just like a Gen Xer hearing about the powerhouse of the cell again, or for the first time,
In
I don't
decades.
know. I feel like they teach this in high school. I can't remember, but anyways.
Yeah, definitely.
I just dated myself. I don't even remember what the hell I was learning in high school.
But
But anyways, we're going to break it down like it was a high school class. We're going to break down the science, share the history and the latest research, everything from gene therapies to the the latest news that we covered actually on our previous episode for medical news about 3-parent babies. Yes.
which has
3-parent
everything
babies.
to do with this.
Yeah. So we're going to tackle some myths as well. News, sorry to do a spoiler alert, vaccines don't cause mitochondrial diseases or challenges like everyone likes to say. And we do have evidence on that. Here, we're going to basically hear what life is like for those living with that condition. So we're going to start a little bit about mitochondria and what are they?
Yeah. What is this mysterious mitochondria powerhouse of the cell?
Yeah, I know. I have like a picture. in
Me
my
too.
brain.
I have it like in
An electromagnetic photo. Remember the gray ones that actually show it like in a 3D?
Yes. I have like the one from the biology books.
Yeah, like the cartoon.
Exactly. That's the one that like keeps on popping into my head.
Let's start from the basics. So what are mitochondria? Mitochondria are tiny little compartments inside nearly every single cell of your body. And if looked at under a microscope, the mitochondria would appear like a little bean or like a little sausage shape. And then their main job is to produce energy. That energy is called ATP. Moving on.
That's it. It's a fuel.
That's all you need to know.
Yeah.
ATP is the fuel.
It makes your energy, I mean,
Exactly.
your cell do the work.
Exactly. Mitochondria produce about 90% of the energy in our cells. That's a lot. Okay. That's a lot of fuel to be producing. Okay. And you actually need that amount in order to meet your demands in your body. One unique thing about mitochondria, which I think is where everything stems from, is that mitochondria, interestingly, has its own DNA. You might recall that our genetic material, our DNA, is housed in something called the nucleus of the cell, which is basically what we know it as the control center. Mitochondria, which are thought to have originated from a symbiosis eons ago, and that is a whole other topic.
Dinosaur era type of thing.
That is a whole other topic that we can jump into, because it's like, how does two things have different DNA? And there's a whole entire evolutionary process that's discussed about this. But anyways, mitochondrial DNA has only 37 genes compared to the tens of thousands genes in a nucleus, in someone's nucleus. In those genes, mostly help the mitochondria do their energy and producing work. Most of that DNA is used for its function as a mitochondria, not like our DNA having our expression and who we are as a person and all of that.
Remember, when we're talking about DNA, it's pretty much the instruction manual.
Exactly.
That's what DNA is. So then why it has its own DNA, it's because it has its own instruction manual on how to create this fuel, how to create this energy. And then
what
nucleus,
tools it needs and what it needs to make to be able to make this whole entire process work.
Now think about it, that the mitochondria's sole purpose is only to make fuel, to make energy for that cell. So it's only going to have those 37 genes. It doesn't have a very long manual to follow, a very long instruction list to follow of how to do what it needs to do, versus the nucleus inside each different cell in our body has an incredibly long and dense manual, because it's a way different process. It's a lot harder, the things it's got to do. Think about, for example, a neuron. Okay. Neuron is a very complicated cell, and it does a lot of things in a very complex way. It's got to have a longer and bigger instruction manual to do what it needs to do.
Yeah.
So that's just to compare, like why one has one DNA and why the other one has a very different DNA. The little mitochondria is just a fuel tank to make that nucleus and that whole cell to go and do what it needs to do. Like the neuron to do the connections and do everything that it does in the brain, the liver cell to do everything that it needs to do for a liver, etc. That's as Barney style as I could bring it to you.
Yeah.
That's it.
And, it's so interesting, right? And this, of course, is like the biologist in me. It's like having the mitochondria have different like DNA. It's like, what is that a remnant of? It's like evidence of
Bacteria,
evidence of how it evolved. Okay. Anyways,
Yeah.
that could like, Julie and I can like literally go off on that for a long time. So in summary, the mitochondria is the cell's powerhouse generators. So they keep our brains thinking, our hearts beating, and our muscles moving. Okay?
Exactly.
Now we're going to talk about what happens when it starts to fail. Okay, so that's where mitochondrial diseases come in. What is a mitochondrial disease? Mitochondrial diseases, sometimes called mitochondrial disorders, refers to a whole group of illnesses caused by mitochondria not working properly.
Not challenges.
Yes, not challenges. This is
It's not called a challenge.
and again, so vague. What does that mean? It's so vague.
Challenges.
Yeah. Anyways, so in these, I can't imagine. Can you imagine like you had a bad day and you went to the airport and you didn't sleep or something like that, and someone looks at you and they're like, she must be mitochondrially challenged. Like,
that's what I'm saying.
Truly, we cannot make this up. We cannot make this up.
You can't.
So anyways, back to our mitochondrial disorders, the real things.
Actual.
So in these disorders, the cells can't produce enough energy, okay? Which leads to a dysfunction or a damage in various organs. Essentially, it's an energy crisis at the cellular level. If cells are chronically starved for ATP, organs that
fuel.
Yes, which is our fuel. Organs that normally demand a lot of energy, like our brain, muscles of the heart, kidney, liver, etc., it's going to begin to suffer. Those organs are going to start suffering. This can result in a constellation of symptoms across the body, ranging from muscle weakness to fatigue to neurological problems, organ failures, and a lot more.
So think about breaking it down Barney style, right? So think about this brand new table that I have here right now, and I didn't follow the exact instructions.
Yeah.
What's going to happen with that table? It's probably going to fail at some point. It's going to be a little wobbly. It's going to not do exactly what it needs to do. It's probably going to be slanted. That's essentially what's happening here. So they missed a step because they didn't follow those instructions in that DNA, and because there's a faulty problem happening with the mitochondrial DNA. So at the end, the end product is not the table that I actually needed. It's going to be a faulty table.
Exactly.
So that's an analogy, easy to understand. Continue. Yeah. That's what I'm here for.
That's actually perfect. I'm going to use that from now on.
There you go.
In my clinic, when people start asking me, I'm going to use it just like that. That was perfect.
You didn't follow the instruction manuals to build a table.
Yes, exactly. Now, one challenging thing about mitochondrial diseases is how diverse they are.
Exactly.
There isn't just one mitochondrial disease. There are
so many, guys.
so many of them.
Guys, there's no way we could cover all of them in this episode.
And each causes different problems. And in each person, even if you have the same exact mitochondrial disorder, which is weird, you're still probably not going to have the same symptoms.
This is what I said about tentacles. This is where the tentacles come out. Yeah. It just branches out. And then each person, again, like, let's say I have a mitochondrial disorder. I could be like running my life totally fine. Like if nothing, maybe I'm a little like, I don't know, maybe I have a little something here or another. But then my child may get it from me. And then they may be bedridden.
Yeah.
But they have the same one as me. It's just the expression is different.
Exactly.
It's crazy.
That's a perfect word for Jules to use. Expression is everything. In genetics, you have the genes, right?
The instruction manuals.
The instruction manuals. However, how it's expressed, how that error in the gene is expressed and what it actually comes off in every single like day-to-day life,
how it shows up,
is different.
Yeah, exactly.
So some mitochondrial disorders are named syndromes with acronyms. Okay.
I had never brought it up because I feel bad because I have the same thing. I have the same thing. I
Julie,
all the time.
No, you need to tell me. You need to tell me, girl. All right. So it was so bad that I actually looked up a bunch of like apps for speaking so that I can practice like
good.
my speaking.
Oh, and let me know about those apps so I could do it too.
I'll send it to you. They're like little short things. I was just like things that I can do like on my drive to work and because after I saw myself, I was like, I really need to like articulate better.
But that's the thing. You've only seen like my heavily edited.
That's what I'm
stuff,
saying.
so you
I
haven't-
don't see the raw footage. So when
Yeah.
I started seeing the raw footage, I was like, I sound like una salsera.
No, dude, that's me too. Like all the time, I'm like, so. I'm like, God, stop saying so.
I know.
But there's a. I can't think of the word, and it's really annoying me right now. But
Anyways.
we all have them. We all have them.
All right, so some
See,
mitochondrial
there you go. I do the same thing. So.
Some mitochondrial disorders are named syndromes with
Yeah.
acronyms that hint at their symptoms. Now, a few of the best known examples is MELAS, so MELAS, short for mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes. As the name suggests, it causes stroke-like episodes. You can have seizures and neurological symptoms in children or in young adults, along with LHON, so Leber hereditary optic neuropathy, primarily affects the eyes, leading to sudden central vision loss, often in young adult males, as the optic nerve degenerates. So you also have MERF, MERFF, which stands for myo. God, I haven't read these in forever.
It's just that's why this is when I started reading this, I'm like, what the? Why are this is like?
Yeah.
This is so ridiculous. Like how we. Okay.
So another syndrome is MERF, MERFF. This is myoclonic epilepsy with ragged red fibers. Patients experience seizures, myoclonus, and muscle jerks, and a muscle biopsy shows characteristic ragged red fibers, which are just clumps of defective mitochondria. You also have Lee syndrome, a severe neurological disorder, usually starting in infancy, can also lead to subacute necrotizing encephalomyelopathies. It causes developmental regression, muscle weakness, feeding and breathing difficulties, and brain lesions visible on MRI. Lee syndrome often leads to life-threatening complications in childhood, so that's definitely one of the more serious ones. You also have KSS, so Kearns-Sayre syndrome. Typically begins before the age of 20 with progressive paralysis of the eye muscles, external ophthalmoplegia, and pigmentary retinopathy, which basically causes some vision changes. And it can also include heart block and other systemic problems. KSS is usually caused by large microdeletions. So that's like an oxymoron. So KSS usually is caused by large deletions in the mitochondrial DNA. These are just a few of these disorders.
And as you could see,
Just
they're
a
very.
couple.
It's more like to illustrate how
Diverse and vast.
exactly and how difficult this is. Like this is not something as easily as like, oh yeah, just walking in an airport, I could see a child
Or
and say,
going to
no.
a doctor and explaining these symptoms.
Yeah.
This is very difficult.
It's just yeah.
But people like to just say, oh yeah, I could just look at it out on the street.
Clearly, you
Or-
cannot. You need an actual biopsy for one of them, and then for the other one, you need an MRI of the brain.
And it's just so disrespectful, the other people
Absolutely.
online that are built like mixing some vitamin water and
God.
saying this is great for mitochondrial challenges.
That's not
And
how it
it's
works,
so
hon.
it pisses me off so much because you have no idea what the family of a loved one with a mitochondrial disorder actually struggles with.
Yeah.
If only it could just be fixed with a vitamin water. Like it's so I just want to like slap them.
My eyes are just gonna permanently
Can you
like stay
imagine?
backwards.
Yeah.
Like
If only it was that easy.
God, I can't.
So these are just a few. There are many other mitochondrial disorders. What unites them is the root of it all, which is a dysfunctional mitochondria and the energy shortfall in the cells.
Not following those instructions,
Exactly.
leading to problems.
Yes. And because mitochondria are everywhere in every organ system, it's often multiple symptoms and organ dysfunctions at once. Common symptoms across the disease it's so vast. It's
Yeah.
muscle weakness, exercise intolerance, fatigue, neurological issues such as seizures, strokes, vision, hearing loss, ptosis, which is drooping of the eyelids, diabetes, problems with your heart, and the arrhythmias with the heart,
That's
liver
why
issues, kidney issues. It's just, that's what I'm saying.
Yeah.
You're not going to go into an office and just say, I have, it's
Yeah.
it's so dense. It's so dense. So dense. Symptoms can, again, start at birth. It can start maybe a little bit later in adulthood. It can be
Which makes it even
incredibly-
harder to diagnose, and it's even more vague for that reason, because it could happen either at birth or like later in your adulthood.
Yeah. And again, most of these are hereditary, right? That's also a very confusing part. If it's hereditary, well, why didn't it present itself until later? It's very it's a lot. It's a lot.
It's a
so,
lot.
you know, before you start watching these videos and thinking, oh, it's all just like black and white, it's not. It's actually very gray. Very gray.
One of the grayest topics I think that we've covered.
Yeah. Now, this variability has a lot to do with the unique genetics of the mitochondria, which we can explore in another episode if everyone is interested in that. I hope not. Actually, it'll probably be less medicine and more biology.
Yeah.
Which, me and you, like, we could
Oh,
we could go
We could go all day, but
Yeah,
I don't
we
know
could
if
go.
you would want us to go all day on that.
on biology. Yeah.
All right, so talking about a little bit about the history on this, because it seems like this just popped out of nowhere, right?
Yeah.
The concept of mitochondrial disease is kind of relatively new in medicine. The first clue that mitochondria could be at the heart of a human illness came in 1962 when Dr. Rolf Luft, I'm not Swedish, that's my best attempt, in Sweden, described a mysterious case. His patient had an insanely high metabolic rate, so essentially burning energy at like a really, really fast pace, right? So yet had normal thyroid hormones. So he was like, what the hell is that?
Yeah.
Much like how I was throughout this whole episode.
And again, the reason why we bring up the thyroid is because if you have a thyroid malfunction or like a hyperthyroidism or something like that, you're going to have an elevated heart rate. So he checked the thyroid. It wasn't the thyroid. And he was like, what's going on?
Like why? Muscle biopsies revealed a bizarre and abnormal mitochondria under the microscope, and even defective energy production because it was abnormal, right? This became known as Luft syndrome because obviously he's the one that discovered it, so he should have the name. Why not? So
Like every other scientist out there.
pretty
even
much
under myself.
all these syndromes, and then I don't know how you guys did it. You guys had to like
Oh, yeah.
memorize all these syndromes that like the names had nothing to do.
I was actually so angry. I remember having a moment where I think I was studying genetics, and I was just flipping through the pages, and I was like, why was everyone so egotistical?
Yeah.
Having to name everything after themselves.
It's true. And it's like,
Why
how are
couldn't
you
you
gonna-
just name it what it is? No, you
Exact-
had to name it your last name.
Yep.
Syndrome. X syndrome.
Yeah, and it's like, how am I supposed to remember all of these names with the
I don't know.
symptoms? It's yeah. Anyway, so at the time that this became the first documented mitochondrial disease. So at the time, it was a complete enigma. A little fun fact here: Luft's patient is said to have had the highest recorded oxygen consumption at rest, as if her body's engines were just like stuck in that revved speed when you're in a car. Let's say you're parked and you're just on park, but you're constantly like pressing the gas. That's pretty much her body.
Yeah.
Was her body. Like, oh, I can't even imagine that. So Luft's discovery was the first time anyone linked a human disease to malfunctioning mitochondria. So for a couple of decades after that, mitochondrial disease was recognized only by such clinical observations and lab clues. In the 1970s and early 80s, doctors identified a few more cases. Luft's disease remained one of the rarest. Only a handful of patients ever were documented with it. Back then, to diagnose a mitochondrial disorder, doctors relied on triad of evidence. First, abnormal mitochondria seen in muscle biopsy, those ragged red fibers that Evie had talked about earlier. The second one was biochemical tests showing deficient energy production or lactic acidosis. And then the third, clinical symptoms affecting the brain and muscles like seizures, strokes, muscle weakness. But they didn't yet know the actual genetic cause. A major breakthrough came in 1988 when separate research teams made landmark discoveries. In London, Anita Harding and colleagues found deletions in the mitochondrial DNA in patients with certain muscle diseases. And in the US, Dr. Douglas Wallace's team at Emory identified the first...
Emory.
Identified the first point mutation in mitochondrial DNA in a family with one of the syndromes that she had mentioned in the previous section, LHON or LHON. So Leber's hereditary optic neuropathy. This was huge because it proved that mutations in tiny mitochondrial genomes, so in those instruction manuals for the specific mitochondria, could cause human disease. The field of mitochondrial genetics was then essentially born. From that point on, the floodgates opened. Through the 1990s, scientists discovered dozens of mutations in mitochondrial DNA linked to various syndromes. And see, this is how science works. It's ever evolving. It's not like, oh, because that didn't exist back then. This was in the 90s when this was linked.
Yeah.
When this was discovered and being an actual link in between these things. Obviously, it didn't happen before, and they weren't talking about this before because they didn't even know it existed before.
Yeah.
They also realized that mutations in nuclear genes, so in that nucleus of that cell that this mitochondria is powering up, they code for mitochondrial proteins that can cause disease too. In other words, mitochondrial diseases might come from two genomic sources. From the 37 genes that are like the instruction manuals for the mitochondria alone, or among the 20,000 plus genes that are involved in the nucleus to help the mitochondria work. Okay, so it could come from either one. But in the early 2000s, it became clear that mitochondrial disorders were not as rare as previously thought, because now that they discovered it, now they're linking it and learning more and doing what science does.
Epidemiological.
Studies in various countries converged on an estimate that about 1 in 5,000 people worldwide had a mitochondrial disease. Still pretty rare. Moreover, genetic screening found that roughly 1 in 200 healthy people carries a potentially pathogenic mitochondrial DNA mutation without even knowing it. That was an aha moment, and it highlighted a large reservoir of mitochondrial mutations and explained why these diseases, though individually rare, collectively are among the most common inherited metabolic disorders. But it's under that umbrella of
Yes.
the inherited metabolic disorders.
There's a lot of metabolic disorders.
Yeah.
There are inherited metabolic disorders. However, the ones that we're specifically talking about right now are the mitochondrial.
In terms of historical milestones, we should also mention the discovery of mitochondrial DNA itself. Scientists confirmed the presence of DNA in the mitochondria in 1963. This finding laid the groundwork for understanding maternal inheritance and the unique genetics we'll discuss next, okay? Which that's when we're gonna talk about that the mitochondria, yes, it's a powerhouse of the cell, all these things that we've talked about, but it's also specifically comes from the mom. To sum up, the journey of this discovery went from an odd case in 1962 to genetic confirmations in 1988 to an expanding catalog of mutations in the 1990s to the 2000s. And now we're in the era where mitochondrial medicine is a recognized field. It's often said to have a coming of the age in the last 30 years or so. So it's relatively new and we're still learning from it.
Yeah.
Next, let's get into why these diseases even happen. Basically, the genetics behind the mitochondrial malfunctions.
Yep. All right, so causes and how it's inherited. Mitochondrial diseases start with changes first, obviously in the mitochondrial DNA, and it lives inside the mitochondria. So you inherit these mitochondrial DNAs basically only from your mother. If a mitochondrial DNA gene has harmful changes, a mother passes it to all her children. Fathers do not pass it along. Classic mitochondrial DNA disorders, including MELAS, LHON, MERF, and Kearns-Sayre, are all going to be inherited through mom. Second is the nuclear DNA, or our normal DNA, every single time that we talk about DNA that comes from both our parents. Harmful changes here also cause mitochondrial diseases, and the inheritance often follows familiar patterns like recessive, dominant, rare, or rarely X-linked in some cases.
A lot of genetic terms, and we're not going to go into the...
Oh yeah, I didn't even
What?
second guess. I didn't even think about that.
Oh, yeah.
Yes, these are just different genetic patterns that I just mentioned. Here's why the severity varies so much. Each cell holds many mitochondria. Some carry mutated mitochondrial DNA, other are normal, so it can actually be very mixed. And this is called heteroplasmy. Just accept the word heteroplasmy. It's a mix of normal and mutated mitochondrial DNA. Symptoms show up once the share of mutated mitochondrial DNA in a tissue passes a threshold. Once you start accumulating a lot of that mutation in the DNA of that mitochondria, that is where you're actually going to see the expression of that. Different tissues hold different mixes. One person has mild symptoms and a relative can possibly have more severe ones.
Right.
Now, there is one more twist on the mitochondrial disorders bottleneck. When a female forms eggs, only a small sample of her mitochondria actually move into each egg. So by chance, one child inherits few mutations and stays well, and a sibling can actually inherit many and becomes ill. New mutations can also arise in a child with no family history at all. And not every energy problem comes from genes. Some drugs, toxins, infections, or regular aging can actually injure the mitochondria as well.
Exactly.
So if you see where we're going with this,
Yeah.
this is super complex, not as straightforward as everyone seems to be talking about these days.
Yeah.
There are so many moving pieces to this
I'm telling you guys, like,
game of mitochondrial
as
disorders.
I was putting together this episode, it was more and more apparent how much BS this is, because there's no way that this should be trending as it is.
Exactly.
This is so dense.
Yep.
There's so many moving parts to it. There's so many different ways of all of this happening. And it's just, it doesn't make any sense to me.
Those cases are secondary mitochondrial dysfunctions, not primary, bottom line. Mitochondrial diseases comes from mom's DNA. These are the bloopers that I love.
I know. And a lot of the time I keep it in because
Yes,
it's like,
we have a folder for bloopers, right?
yes, we do. But I honestly haven't, because I just leave it into the episode.
Mitochondrial diseases comes from mom's mitochondrial DNA or from either parent's nuclear genes, the nuclear DNA, or from new mutations. So mix and the threshold drive how severe it is.
Yep.
Even if it's just within one family, you can have a really stark difference in symptoms between one person to the other. Now, do you want to do symptoms and impact?
Yeah. So symptoms and impact. Mitochondria powers every cell in your body. These diseases can touch almost every organ because every organ has its own set of cells, right? So brain, muscle, heart, eyes, ears, gut, hormone glands, like everything. Okay. And think about it even like in the hormone glands, how much your hormones like control and do to your body. The result is often multi-system picture that does not fit really into just one diagnosis. When we're talking about muscles and movement, people feel weak and tire fast. Babies can be floppy, miss motor milestones, things like that. Older kids and adults may struggle with exercise. Cramps, muscle pain are pretty common in these cases. And in the syndrome that she had talked about, MRF, you could find muscle jerks and seizures pretty much stand out. Balance and coordination problems can also appear. When we're talking about brain and nerves, for example, the brain uses a lot of energy. Symptoms there are frequent. These include developmental delays, learning problems, seizures, migraines, strokes, things like that. Now, for example, in the syndrome MELAS, MELAS, this could cause stroke-like episodes with lactic acidosis, which lead to weakness, vision changes, or even speech trouble. Some people develop cognitive decline. Peripheral nerves can be involved, and that could cause like numbness in some people, and even burning pain if not. So like the polar opposite of that. When we're talking about eyes and ears, these people could have vision or hearing. That's often the main focal point here. With people with LHON syndrome, they could experience sudden painless loss of central vision in young adults. With the current SARE, they could experience like limitations in eye movement and even causes of pigmentary retinopathy. I'm going to do retinopathy just to annoy her. Retinopathy. Yeah. I mean, it had to happen. We're talking about genetics here. I had to. Retinopathy.
Oh my God, that one was so good. That one was so good.
It was about time. It was about time. It was about time. I had to do it. I had to do it at some point.
Yeah. She actually had a really good stride.
Yeah.
And then, but this, It was great. Great.
All right. That. And then also hearing loss is common, often in early life. So the combo of hearing loss plus diabetes in young people should raise suspicion for a mitochondrial disorder. Now the heart, it's also another organ that's going to need a lot of energy. So the heart can weaken, and that's called cardiomyopathy.
Yes. Good job.
The electrical system can misfire, causing conduction blocks or arrhythmias. In current Sayre, am I saying that right?
Current Sayre, yeah.
Yeah, carries a high risk of heart block, which may need a pacemaker. Some nuclear gene disorders, such as Barth syndrome, see, there's so many that we didn't even talk about this one. But in this one, it can mainly be affecting the heart and the muscles. Now, when we're talking about the endocrine and the metabolic, you would see hormone systems that can be disrupted. So diabetes is pretty common in MILAs, often starting in adolescence. I was about to say adolescence. Thyroid or adrenal problems can occur. Short stature, and poor growth reflect chronic energy shortage. Many patients have high lactic acid, which could cause fatigue and rapid breathing and nausea, especially during illness or exertion. Then the digestive system, the other part that's going to need a lot of energy as well. I'm just mentioning more like the high energy organs and systems that need all this energy from the mitochondria. So you're going to see swallowing problems, reflux, chronic vomiting, and slow gut movement are frequent. Some develop pseudo-obstruction. Liver disease can even occur, from infantile liver failure to certain mitochondrial DNA deletions to severe liver disease, with even in seizures. Just to generalize and end this, the symptoms section. Poor growth can persist despite adequate calories. Fatigue is universal. Ptosis. Ptosis. Okay, there goes English again, putting a P where it doesn't belong, but whatever.
A silent P.
Why do we have a
silent P? I don't know.
Anyway, droopy eyelids is a classic sign in some syndromes. Infections, fever, surgery, or fasting can trigger a mitochondrial crisis where the body decompensates and hospitalization is needed.
Yeah.
Now, there's range and variability in this because symptoms vary widely. So one person may have mostly muscle fatigue and another may have epilepsy and learning issues. Another may face blindness or heart failure. Even within the same syndrome, such as MILAS, one patient may have frequent stroke-like episodes, while a relative has mainly hearing loss and diabetes. These conditions are called great imitators because they mimic many other diseases. Many patients see several specialists before the puzzle even comes together. That's why when such person goes ahead and says, I could just see a mitochondrial challenge just by looking at a child.
And it's like what I said, even in the hospital, there's a lot of specialists on board, it's very complex and it's complicated, and we do our best to have a whole multidisciplinary approach so that it's just better care for a patient that's complex.
Yeah. So course in daily life with everything that I had just talked about, like symptom-wise and whatnot, many primary mitochondrial diseases are progressive, meaning that they're worsening as more cells cross the energy threshold. Some forms, such as Lee syndrome, can be life-threatening in early childhood due to breathing failure. Others allow normal or near normal lifespan with chronic issues. Day-to-day, people learn to pace activity, plan rests, and use supports such as mobility aids, feeding tubes, hearing devices, or pacemakers. Care is coordinated across multiple specialties. Uncertainty is common because progression can be hard to even predict. And closing off with that, next we're going to find out how doctors figure this out, because clearly there's so many things that it can lead to it or not. It could lead to a whole different thing or a mitochondrial disease, and how they make this very vague diagnosis an actual diagnosis.
Yes. We're going to jump into diagnosing these mitochondrial diseases. There's no single yes or no test to mitochondrial disorders. Doctors look for a pattern across organs and they confirm with targeting testing. Step one is always going to be the same for any patient, which is a history and a good physical exam. It's a multi-system problem, especially in the brain and muscles together. It kind of raises suspicion. Now, family history does help, but an inheritance can be tricky. Like we've mentioned before, sometimes you can have a family history, sometimes not. Now, basic labs can point the way, like a lactate may be high. Two newer blood markers, FGF21 and GDF15, often rise in mitochondrial diseases. Now, normal results also don't rule it out. So genetic testing is central, but doctors test mitochondrial DNA and nuclear genes. A diagnosis is firm when a disease-causing mutation matches the symptoms. For those of you that have never been to a geneticist, we can run a gene panel, right? It's a panel of all these different things according to a symptom, right?
Yeah.
If you have some sort of bone problems and it's kind of rare, then we can go ahead and do some gene paneling for that specific symptom or sign. And these are the genes that are highly associated to that. But even then, if that is negative, that doesn't mean that there's no genetic problems, just for the ones that we tested.
Exactly.
This is kind of along the same lines. Now, sometimes blood is not enough. Another way that we test this is tissue testing. Muscle biopsy is used when genetics is unclear. Pathologists look for ragged red fibers and to test the activity for a respiratory chain enzyme. If genetics already gives a clear answer, then biopsies can be skipped. It's not necessary, but again, these tests together can give us a better idea of what the whole picture looks like. Now, organ testing, depending on the symptoms, that can also be an option. A brain MRI, eye and hearing exams, and heart studies can also show typical changes and kind of like map how far the disease has spread, or like how far like those symptoms can go if we really follow them.
Yeah.
Most patients do best at a specialty center because it is a center specifically for this kind of disorder, and the resources are going to be better and know how to move in which direction. And diagnosis can take time, but it matters. It guides treatment choices, plans for illnesses and surgeries if needed. We can also do family planning as well. Now we're going to talk a little bit more about the treatment and management of it. Again, no cure exists yet. Care focuses on symptoms and organ protection. So I'm going to say it again. The vitamin water is not going to work. Okay. Yeah. And I'm sorry. I really apologize for those patients that
God, I know,
have this and have, these people out here saying that this is just because, I don't know, you didn't take your colostrum like supplement.
Yeah. Oh God, no. Oh God only knows what. They're advertising the weirdest stuff these days.
Yeah. So again, using standard treatments for each problem is going to be essential. Seizures get anti-seizure medications. Heart block needs pacemakers. Heart failure uses guideline medications. Diabetes uses insulin or other oral drugs. Hearing loss uses aids or trochlear implants. Physical, occupational, and speech therapy are going to be so important to support strength, mobility, and communication. Many patients take mitochondrial cocktails. It aims to support energy pathways. Now, results may vary by person to person and by diagnosis to diagnosis, but common pieces include coenzyme Q10, which is really helpful primary for CoQ10 deficiency and sometimes in broader myopathies, which is just problems having to do with muscles.
Yeah.
Okay. Now, riboflavin is useful in riboflavin responsive defects such as ACAD9 or ETFDH. Carnitine, which levels can be low from secondary loss. Creatinine to kind of buffer muscle energy with mixed evidence. Arginine.
Creatine is having a huge moment right now.
Yes, I know.
Wow.
I even have like teenagers on it too.
Oh my God. And but isn't it like a little dangerous for the kidneys though?
It can be if you like surpass the recommended amount, but
which
again, it's
now
like,
that it's trending, I mean, I wouldn't be shocked if there's like,
Yeah. Now, you can also do arginine, like in Milas during a stroke-like episode. If you give that IV in emergencies with oral arginine and citrulline between events to cut that recurrence. Again, this is my problem. I feel that everyone in this pseudoscience, naturopathic world will shit on medicine because they're like, they just want to give you a pill for everything. Have you ever had a seizure? Yeah, I'm pretty sure that you're going to want a pill for that to prevent that. for sure. And also, we're not saying that you don't need some vitamins. We're talking about CoQ10. We're talking about carnitine, creatinine. But not creatinine, creatine. We're talking about arginine, right? So these are all things that we actually do give. But remember, it's if there's a deficiency, right, associated with it. If you have this,
if your labs are normal,
if you have normal levels of this, you're not going to need a supplement for something that you already have. Now, yes, some of these supplements might be given to kind of prevent maybe an episode. Right. So I think that that's fine. No one here is saying that you can't take a vitamin.
Right.
But the fact is that these other people and other
wellness
influencers are kind of saying, you know, in a verbiage that you just need this. And the reason why you have what you have is because you're not doing this. And that's not true, right? So now,
hold. Are you engaged?
No, girl.
Oh.
No,
I'm like,
I have it on both ends.
Oh, fuck. Okay.
I have an M and an N.
Oh.
Yeah. And an M.
I'm like, hold the on. What the?
Do you think that you want to know?
Well, hence, did you not see my reaction? I'm like,
wait. I'm like, later on, I want to replay that.
I'm like, I'm not gonna overreact here. Did you not?
I'm like, no, girl. I have to.
Continue. I was about to be really, really insulted right now.
This girl swears. All right. So anyways, kind of hopping back onto the supplements. Antioxidants just such as vitamin C and E and vatiquinone are under study. It's not like we're ignoring any of this.
Yeah.
But it's being studied. And it's really crippling. It's really crippling when someone really tries to sell you on something as a cure. Yeah. And that is my problem. They sell it to you as a cure.
Exactly.
Not to help you with other things, but as a cure.
Right.
Now, these supplements are not cures. So they aim to ease fatigue or improve function in select cases. Now, regimens are individualized. That's why most of the time it's actually good to go to a specialty center, right? Because all they're doing is that. So regimens are individualized. Everyone is different. Diet, lifestyle do matter. Avoiding fasting, okay? Eating regular meals to prevent catabolism, which is a breakdown in your metabolics. It's like a state of metabolism. Now, maintaining hydration is also going to be really, really important. Some do better with a higher energy diet and adjust to its tolerance. Moderate supervised exercise to kind of build your endurance and promotes new mitochondria. Overexertion triggers setbacks. Pacing is key. You don't have to kill yourself at the gym, right? But preventing infections with routine vaccines and good hygiene is also really important. Yeah. Now, avoiding harmful drugs. So like high dose valproic acid. I know that everyone that I just said, you know, anti-seizure medications, and they're going to talk to me about like valproic acid. Again, high dose valproic acid poses serious risks in disorders such as POLG related disease. Linezolid and chloramphenicol, which are really strong antibiotics, can sometimes impair mitochondrial protein synthesis. So use of anesthesia and perioperative plans familiar to mitochondrial centers. Plan ahead for illness. Many teams provide a sick day plan. So basically a plan that you follow, and I can attest to this because when we would have patients with mitochondrial disorders, we had a specific thing that we needed to follow and make sure just because we know what works for them. And we also provide emergency letters and guidance for IV glucose during acute stress. So it's very, very specific and very complex. Now, with thoughtful, consistent care, many people stabilize and keep a good level of function, even as research pushes towards disease-modifying therapies, which is something in the future that hopefully can really help someone.
So research and new frontiers, right? Because again, this is kind of a new field in the whole scheme of like medicine. We're only like discovering more, learning more about it, and now like putting more into it like to help. In recent years, the mitochondrial disease research has been energized, no pun intended. with new ideas and approaches. Scientists and clinicians are attacking the problem on multiple fronts: genetic therapies, novel drugs, and even revolutionary reproductive techniques to prevent transmission. Stay tuned and also listen to our latest medical news recap. Let's highlight some of these developments. Mitochondrial donation. We talked about this one as well in that episode
that we just mentioned.
This was about that 3-parent baby IVF that you probably saw everywhere on the news, because it is pretty astonishing that this was even able to be done. So one of the most headline grabbing advances is a technique to prevent children from inheriting that mitochondrial DNA mutations, right, from the mom. So officially called mitochondrial donation treatment, MDT, or mitochondrial replacement therapy, MRT. And it's an IVF procedure where you combine the DNA of 3 people to make one embryo.
Yeah.
How does this work? The prospective parent goes through IVF, the mother's egg and the father's sperm creates an embryo. But that embryo carries the mother's faulty mitochondria.
Because remember, mitochondrial disorders are inherited, the genes from the mitochondria are inherited from the mom.
Exactly. Then in parallel, an egg from a healthy donor with normal mitochondria is fertilized. Then the nuclear genetic material, which contains the parent's chromosomes, is taken from the parent's embryo and transferred into the donor egg, which has its own nucleus removed but retains healthy mitochondria.
When I saw that medical news, I was so proud of science. I'm like, wow.
You're operating on a cellular level.
Yeah.
Like,
Which at the end of the day, yes. So let's not be confused. Remember, we did say that some mitochondrial disorders do come from nuclear DNA. So
right. This
but
is when it's specifically
from, if the mom tested and she does carry mitochondrial disorders and they don't want to pass that on to the baby.
Right.
Because again, it could be stronger, right? Like we explained before. So, I mean, this is a huge advancement.
Yep. It's just, I find it incredible how technology
to fertilize the egg
and then
take the nuclear DNA from that fertilized egg,
yeah,
take that nuclear DNA and put it into basically another cell that's had that nucleus removed. So only the mitochondria,
it's cellular surgery. Look that little. We're talking about microscopic, and then
yeah. Well, this is all the research that goes into everything medical, right? So when we're talking about cutting funding for certain research, this could potentially have been one, right?
Yep.
So it's important. Research is important.
100%.
Contrary to, belief online.
Exactly.
Yeah.
So the result is an embryo with nuclear DNA from the mother and father and the mitochondrial DNA from that donor. The baby is born with over 99.8% of their DNA from the parents and just 37 mitochondrial genes from the donor. It's crazy. Hence the 3-parent baby. Though biologically, the donor only contributes to mitochondrial function, those 37 genes. This prevents passing on diseases like Mila's, Elhan, like all the ones that we had talked about earlier. And then the UK, from the maternal side, the UK pioneered this. They changed the law in 2015 to allow it under strict regulation. And as of 2023, the first babies have been born in the UK using this method. Early reports indicate it's working, with donor mitochondria largely replacing the mother's mutated ones in the baby's tissues. The procedure isn't without ethical and technical concerns. One worry is a small number of mothers' mitochondria might sneak through and replicate called reversion, potentially still causing disease. But so far, it's a landmark proof that we can prevent certain mitochondrial diseases in the next generation by using this method. It's not legal in all countries, for instance, currently not allowed in the US, but it's a huge step in reproductive medicine, nonetheless. Now, more on these new therapies out at the works. So like drugs like
Elamipretide and valtoquinone,
what she said, have shown mixed results in trials, and neither has US approval for preliminary mitochondrial disease today. Another candidate is
Sunlicrominol.
Yeah, reported phase 2B signals. So, clinical research is active and families should watch ongoing trials, in these specialty centers.
Let's talk a little bit on the myths and misconceptions. The first one, which I'm quite passionate about, is vaccines and their mitochondrial disease. So you may have heard claims circulating online that vaccines can cause mitochondrial, stress or challenges or make it worse, and even in mitochondrial disorders that are linked to autism via vaccination. These assertions largely stem from a misinterpretation of a few cases and have been amplified by anti-vaccine movements. So let's set the record straight with evidence correctly interpreted.
Yeah.
The myth was that around 2007 to 2008, a case of a girl named Hannah Poling became famous. She had a mitochondrial disorder, later then identified through enzyme tests and genetics, and she developed autism spectrum behaviors after a series of vaccinations in early childhood. In a legal settlement, the U.S. Vaccine Injury Compensation Program, which is a very well-known program, basically, if you believe you suffered something from a vaccine, this is a program that is going to basically take care of you and compensate you for an injury which you feel has been related to a vaccine. That's like the most simplest term. There's other things to go in there. But anyways, so the U.S. Vaccine Injury Compensation Program conceded her case for encephalopathy, brain dysfunction, after vaccines, which anti-vaccine groups misinterpreted it as the government, admitting that vaccines caused autism.
Oh, God.
That is not the same thing. That is not the same thing, which is not what actually happened. So what happened in that case is likely that the child had an underlying mitochondrial dysfunction, and after vaccination, or possibly due to a fever from the vaccines, or even an intercurrent viral infection, or around the same time, we don't know, she regressed developmentally. This temporal association fueled the speculation that vaccines might be a trigger for mitochondrial diseases or symptoms or autism in a subset of kids, which is not true. She was diagnosed with a mitochondrial disorder. And we know that some mitochondrial disorders can actually cause encephalopathy. When she did receive the vaccine, not because it was the actual vaccine, but maybe through a process, or maybe she was sick at the same time. And she had that. But anyways, this program that exists for this sort of situation conceded her. And then instead of people saying, well, no, it was because of the program and everything, they said, oh, well, that's the government admitting that it does cause it, right? Why would you compensate if you don't feel like it causes it? Now, it's a whole entire program dedicated to that. So the evidence is extensive research since then has not found any credible link that vaccines cause mitochondrial diseases or worsen them. To quote the CDC and experts, as of now, there are no scientific studies that say vaccines cause or worsen mitochondrial diseases. We do know that infections, illnesses that vaccines protect against, can be very dangerous for children with mitochondrial disorders. So in other words, the risk, if not vaccinating, is actually higher for these kids. So if a child with a mitochondrial disease gets the flu, their compromised energy metabolism might lead to a severe crisis, hospitalization, regression, and yes, death. So vaccines prevent those infections, thereby protecting the vulnerable patients from a major stress on their system. Now, several studies have looked at cohorts and patients with mitochondrial diseases or metabolic disorders and vaccination, and they have not found any unusual rates of complications beyond what we'd expect, right? The way that works is that when you go and see these complications, we need to compare it to the regular baseline rate that we see these complications. And they have not seen an increase after a vaccine. It appears that while any fever or illness, including the vaccine-related fevers, because you can have a fever from a vaccine, it happens, you're creating antibodies, it can happen, can temporarily stress a child with a mitochondrial disease. It does not cause new disease. In fact, a review in Neurology Journal addressing the so-called vaccine encephalopathy in children, like Dravet syndrome, which was the once misidentified as a vaccine-related gene mutation in SCN1A, that were found concluded that no clear evidence exists that vaccines trigger or worsen mitochondrial neurological regressions beyond what ordinary viral fevers can do. So in Hannah Polling's case, for example, the little girl we just talked about, it's very plausible that if she had caught a fever illness naturally, which they can, the same regression might have occurred. And it was an underlying vulnerability unmasked by stress, not something unique about the vaccines themselves. To put it unequivocally, vaccines do not cause mitochondrial diseases. They do not cause, your DNA to alter mitochondria, and they don't introduce mitochondrial mutations. Those diseases are genetic, often presenting from birth. And well, what about, triggering a regression? It's exceedingly rare and not well documented that any child without prior symptoms would suddenly develop a full mitochondrial disease due to a vaccine. What has been seen is that a child who already has a mitochondrial disorder, diagnosed or not yet diagnosed, any significant stress,
could be anything.
High fever, surgery, dehydration could actually potentially provoke a setback or regression. Now, vaccines is a tiny controlled exposure by comparison to many infections. And importantly, the infections that vaccines prevent, like flu, measles, varicella, all the ones that we vaccinate against, can cause severe metabolic decompensation in patients that have mitochondrial disorders. So avoiding vaccines would put them in way worse
harm.
Yeah, it would put them in a situation that would be way worse. In short, the vaccine autism mitochondrial disease connection is a myth. It arose from a unique case and a misunderstanding and a misinformation, the misinformation that was spread. Extensive data shows that vaccines are safe and important for children with mitochondrial diseases and everyone else. The science speaks clearly. And dispelling this myth is really crucial because we don't want fear of vaccines to cause additional preventable tragedies, especially in a population that is actually more reliant on herd immunity and disease prevention. Now that we've covered all of that misconception, we're going to move on to a more personal side. What is it like to live with a mitochondrial disease and why awareness and continued research still matters?
Which I can only imagine, like how people that actually have this diagnosed, right? Not just like, you look like you have it, you know? Like actual people with this diagnosis, how they must feel listening to everything that's going on right now. Anyway, let's talk about what it is. Living with a mitochondrial disease can be challenging and unpredictable, like navigating with a faulty battery that might drain faster on some days than others. Because these conditions often affect multiple body systems, patients, and of course, you gotta remember their families too. Their loved ones, anybody that's around them all the time and loves them, must become adept coordinators of care and masters of energy management. Let's paint the picture of like what a daily life, like a day-to-day situation may be for people coping with this in the long term. Energy management. Fatigue is a constant companion for many. Patients often describe having to ration their energy, sometimes called spoon theory, where you might have a limited number of energy tokens, so spoons per day. Activities healthy people take for granted, like showering, walking your dog, a day at school or work, might exhaust a patient with these diseases, just disproportionately to the rest of the population. And pacing is key. Plan activity, then rest, then activity. Many learn to listen closely to their body's signals to avoid pushing and ending up in a crash. As one adult patient put it, I function kind of like a phone that's never charged to 100% and depletes quickly. I recharge when I can, plan around the battery I've got, and always carry a power bank. In my case, snacks, fluids, a place to sit to avoid complete shutdown. Now, a medical routine for these people that suffer from these diseases, regular follow-ups with various specialists are just the norm. One might have an annual neurology visit, cardiology check, like for instance, having an EKG or an echo to monitor the heart, ophthalmology exams, audiology for hearing aids, endocrinology for diabetes or thyroid issues. The list goes on, depending on symptoms. There may be a periodic physical therapy sessions to keep muscles conditioned, and perhaps speeding or feeding therapy if there are swallowing or speech issues. Then blood draws are common to monitor things like lactate, liver, kidney function, especially if on many meds, and of course, nutrition levels. For children, individualized education programs at school might be needed to accommodate learning difficulties or fatigue. You got reduced schedule or extra rest periods too, more time on tasks, things like that, to accommodate. Then you have diet and medications. Many patients take a handful of supplements daily. The Mito cocktail we mentioned, this can be cumbersome. Some supplements taste bad or come in large numbers of pills. Dietary adjustments like high carb snacks or overnight feeding tubes in severe cases to prevent fasting stress might be part of day-to-day life. Some have G tubes, which are feeding tubes, or devices like insulin pumps if diabetic. Patients of children with these mitochondrial diseases become skilled at giving medicines and supplements several times a day, often crushing pills into yogurt or formula for young ones, and maintaining strict schedules to keep metabolic balance. Preventing crashes. Families learn that certain situations can spiral into medical crisis. For example, a simple stomach bug causing vomiting can quickly lead to dehydration and metabolic acidosis in someone with this disease, landing them in the ER. They often have sick day plans, like she had mentioned, protocols provided by their metabolic specialists on what to do if the child can't keep food down or has a fever. This might include taking glucose polymer drinks or going to the hospital sooner rather than later for fluids with dextrose. Dextrose is a sugar, right?
Yeah.
Like a sugar type of situation. Fever management is taken seriously. Fevers raise metabolism, which can precipitate a metabolic crisis. Quick use of acetaminophen or ibuprofen and cooling measures to control fever is common. Similarly, anesthesia for surgeries is at a higher risk. Patients usually need an anesthesiologist who's aware of their mitochondrial condition and uses appropriate precautions. Certain anesthetics are avoided. IV fluids with glucose are given during the procedure as well, and other things, other commodities. Families often carry an emergency letter that explains the person's condition and special needs to the ER. And then you have adaptive aids. Depending on certain disability, some patients use wheelchairs or walkers for mobility when muscle weakness or neurologic impairment limits walking. Others might use hearing aids or cochlear implants for hearing loss or visual aids for vision impairments. There might be breathing support devices at night if there's a risk for sleep apnea or respiratory muscle weakness. These aids greatly enhance quality of life and independence, but they also require adjustments and maintenance. Then, of course, you have the emotional and social impact, because coping with a chronic progressive illness is just hard. Children with these diseases may feel different from peers, especially if they can't keep up in physical activities or miss a lot of school due to the illness. Teens might struggle with the transition to more self-care, responsibility, and the reality of limitations when trying to assert independence, which is critical and huge in your teenage years. This can be anxiety in the family. Every fever, stumble can cause worry about disease progression. Parents often carry the psychological burden of uncertainty. So mitochondrial diseases can be stable for a while, then worsen. It's like having a cloud of like, what's next? When's the next shoe gonna drop type of thing. And that's like always looming for these parents. Many families find help through support groups and foundations, right? And there's a slew of them. I'll list them here for those of you that are watching on YouTube. Even connections with other families that have mitochondrial diseases themselves, or they're in the same family and support somebody that has that disease. People show striking resilience. Many people become skilled problem solvers and strong advocates. Young adults share the stories behind support groups and join research. As awareness grows, schools and workplaces offer more flexibility, including remote options and adjusted hours. Specialty clinics provide coordinated visits. One appointment brings multiple specialists, nutrition support, and therapy. These centers often offer access to clinical trials as well. And then planning matters, right? So adults with mitochondrial DNA mutations often seek genetic counseling. Options include IVF and mitochondrial donation where available, donor eggs, and then pre-implantation or prenatal genetic testing for known nuclear mutations. Day-to-day life mixes routine with uncertainty because families learn the science and they track health and they push for services. So small wins matter because fewer hospital stays is a win.
Yeah.
A work schedule that fits energy limits as well. A treatment that eases fatigue, even just a little bit, because every gain is meaningful. So it's definitely more difficult
than just casually spotting someone on the street who's having probably just like a bad day.
Yeah. it's definitely more difficult than when they bring up these things in a TikTok or in a reel or whatever. It's a lot more dense than that.
Yes, exactly. Now everyone knows
Whew.
what a mitochondrial disorder is, what a mitochondrial disease is, and now you can differentiate when a person is talking about like a challenge or, you know,
Yeah.
I'm gonna drink this, you know, just so I can keep my mitochondria like optimized, like to cure this. It's like these mito cocktails that, sure, if you had a deficiency, I'm sure it can
Then
it can help
it's
you.
necessary at that point.
Yeah.
You know? But if you
If like a person is just fatigued, right? And they're like, wow, I'm really fatigued. Sometimes I just want to ask people, like, when you're fatigued, the first 3 questions,
Yeah.
how much water did you take? 9 times out of 10, it is not enough.
Yeah.
My second question, how much did you sleep? 9 times out of 10, they do not sleep enough. What kind of work do you do? Do you exercise? What do you eat? Like all these things that play into probably what
Yeah.
someone feels is chronic fatigue, but goes ahead and buys some like vitamin or something because someone online said this helps me with fatigue.
And again, listen to our pseudoscience episode because we delve into supplements and the world of supplements as well. Not super deep, but good enough for like how this is a $1 billion industry. Okay, so
It's just a business.
all these wellness influencers and all these people that are anti-vax and whatever, they're like, well, because pharma's such a big business. Pharma's making money off of like diagnosing you and giving you these meds and having you drink these pills. And I'm like, how about your supplement?
Yeah.
It's the same thing.
Yes.
It's the same big business.
Yeah.
So what are you talking about? If you don't be a hypocrite.
Yeah.
Don't go ahead and be like pointing. I am not defending big pharma at all. They have a lot of bad stuff to them. A lot. But so does the supplement industry.
Yeah.
You know, they're both in the same category.
And that's like very complex, right? It's like not just like all medications is because like there's like a conspiracy with like big pharma.
But that's how they make it seem.
But of course, that's how they make it sound, but that's not true, right? It has to do a lot with other factors like insurances and
Big time.
policies and all these things that also
Yep.
play into that.
Yep.
But anyways,
So there you have it. Now you know when you hear mitochondrial challenges, diseases, whatever, however it's thrown at you.
it's not that simple.
Yeah. Now you know at least the basis of it. And there's a lot to it. But anyways, thank you guys for checking in. Subscribe, comment, do all the things. Check us out on all forms of socials. We're there. If you're not into social media, we have our email, funnymedicine305@gmail.com. And yeah, we'll see you on the next one.
Bye.